Okay, so the idea that MAID can be done without an anesthesiologist present is not just preposterous, it's deeply irresponsible. You're administering powerful sedatives, paralytics, and lethal agents, drugs that in any other setting require close monitoring to ensure the patient is not in distress. Anesthesiologists are trained to manage these exact risks. Leaving them out of the process isn't just a budget choice, it's a clinical and ethical failure. We wouldn't accept this standard in surgery. We wouldn't accept it in end of life palliative sedation. Right? So, why are we accepting it for the international act of ending a human life? It's not about whether you agree with MAID. Right? That ship has sailed. We don't really care about that no more. It is not really the law, but it's decriminalized, and lots of people are opting to legally do that. I don't know, legally is the right word, but in a decriminalized manner, do that. It is certainly the effective. I mean, sure, it does work, but how does it work? That is the key issue here. It's about basic medical standards and human decency, right? So the lack of anesthesia in MAID is inhumane. Inhumane. Performing MAID without an anesthesiologist puts patient at serious risk of pain during their final moments. Cost cutting over compassion. The absence of proper sedation isn't a clinical choice, it's a financial one, prioritizing budgets over human dignity. Ethical standards are being violated. Right? Medical ethics demand that all patients, especially the most vulnerable, be treated with care and respect. MAID without anesthesia fails that standard. Right? Clare Health Center is failing the vulnerable. There's there's plenty more where that came from. Oh man, this Clear Health Center, it's just I think they're getting a little bit too comfortable with the tax money, and they're just expecting that it's a never-ending stream. I have to put forward the argument that we are the ones that are producing the actual value here, and our tax dollars should be respected a little bit more. Anyway, but if this is happening in Clare, this is in Digby County, Nova Scotia, Canada, then the weakest members of the community are being neglected when they need compassion the most. End of life deserves proper medical care. Just because someone is dying doesn't mean their pain doesn't matter. Death should be peaceful, not rushed and not painful, right? So it should be extremely peaceful. So I don't believe that the way that MAID is being administered here, medical assistance in dying, I do believe it's extremely painful, as it was suggested, in previous discussions that led me to this argument here that is, there's merit to this argument. This is an argument that is formulated in science, medical ethics, in logic. I mean, there's no reason to scoff at this idea like the people, so I put forward this argument on the social media, and then people are just scoffing at me and say, oh, who's this guy? And then they look into my, my social media platform, and they say, oh, this guy is good, blah 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 blah, and they do not attack the substance of this argument at all, right? They cannot. I mean, how can you attack the argument that an anesthesiologist should be present when administering MAID? I mean, this is a solid argument. Anyway, thank you very much for tuning in. I'll see you in the next video.